And it can work if you don't want complexity or the patient doesn't want to use the second method, which involves changing, and I'll get to that. So for example, with this patient, what I had actually tried was to switch her to Klonopin and try to come off that, but she just did not respond well to the Klonopin. She did not like it. She really kind of wanted her Xanax. She just felt like that worked better for her. So this was a more sustainable approach for her. But now the question is, okay, what's the time interval, right? What's the time interval between here and here? So it depends on how long the patient has been on it. So if they haven't been on it for long, like let's say 6 months, then you could do, for example, a week, right? One week, 2 weeks, etc., between intervals. But let's say they've on it for years and years and years, you might need to spread it out further. So so you could do instead 1 month, 2 months. Basically, the interval is arbitrary. You have to kind of guesstimate it based off of how long they've been on it and but more importantly, how well the patient responds. So some patients, they may have only been on the medication for a couple months, yet they may need a slow taper because they don't do well coming off of it. Whereas other patients may have been on the medication for years and years, but they might be able to come off relatively quickly just because they don't have any withdrawal symptoms.